Hello, my name's Emma, and I'll be performing a neuro and mental assessment on you. Can you please tell me your name and date of birth?
Julian Bell, 9/7/2001.
And do you consent to being recorded?
Yes.
Okay, thank you. I'll be walking you through each step of the assessment. Please let me know if you have any discomfort.
Okay.
Okay. Can you please tell me where we are?
Home.
And can you tell me the date?
July 28th,
Of what year?
2026.
And why are you here?
For my exam.
Yes. And our patient is in no acute distress and is well groomed. Now we are going to be assessing your recent and remote memory. Can you please tell me what you ate for breakfast?
Eggs.
Correct. And then can you please tell me when we are getting married?
October 15th.
Also correct. Now we will be assessing the cranial nerves. So I will be using vinegar, a candle, and vanilla. So what I'm going to have you do, so we're assessing cranial nerve 1, your olfactory. So first I'm going to see if your nares are patent. So I'm going to have you occlude one nair, breathe in, and then switch, and then the other. I'm going to have you close your eyes, and then we're going to do the same thing, and I'm going to have you say if you smell the candle, vanilla, or the vinegar. Okay?
Okay.
Ready? Close your eyes. Occlude your right nostril. Inhale.
Vinegar.
Okay.
Candle.
Okay. Now switch. Inhale.
Vanilla.
Inhale.
Vinegar.
Okay. Thank you. Now we will be moving on to visual acuity. So using the Snellen chart, we're going to test his near and far vision, okay? So reading this at like a book length away from your face, I want you to read the last line.
LTFPH.
Great. Thank you. Those were correct. Now I'm going to have you read the most comfortable line you can read from about 6 feet.
Bottom line, LTFPH.
Great. So that was cranial nerve 2 for optics. So that was the near and far vision. So I'm going to put this down, and then I'm going to grab my ophthalmoscope and do a fundi assessment. Okay, I'm assessing the eyes, normal white sclera, eyelashes intact and appropriate, same with eyebrows, no eyes drooping, and then this also might touch on cranial nerves 3, 4, and 6. So I'm going to look into his eye. Red reflex present in the right eye. Red reflex present in the left eye. So now we did 2, 3, 4, and 6. So I'm going to have you look down. Great. So now I'm going to test your, what do I think? We're going to look for pearl. So pearl pupils are round. They're equal. We're going to do the light. So bright light in your eye. Great. Now I'm going to have you focus on my finger. Okay. Pupils equal, round, reactive to light, and they do accommodate appropriately. Now we're going to do I'm trying to find a place for that. We're going to do the cardinal field vision test. So without moving your head or shoulders, I want you to follow your finger with my eye, okay?
Okay.
Great. Extraocular movements intact. And now I'm going to be doing the cranial nerve 7. So I'm going to have you clench your teeth, and I'm going to palpate for muscle asymmetry and then tenderness, okay? So
okay.
Clench your teeth. They're clenched. Jaw symmetrical. Any tenderness?
No.
And then no masses are present either. Now I'm going to be doing, where's my Q-tip? I'm going to have you close your eyes, and well, not right now, but I've got a Q-tip with the end cut off, so that will be our sharp, and then dull, I'll have him close his eyes, and then I'll press on his face, and he'll indicate whether it's dull or sharp. Are you ready?
Yes.
Okay.
Dull. Sharp. Sharp. Dull. Sharp.
Okay. Good job. And now I'm going to be, wait, that was cranial nerve 5 for the facial symmetry. Cranial nerve 7 is cranial nerve 5 is trigeminal. And then cranial nerve 7 is the facial symmetry. So I'm going to have you smile, symmetrical, puff your cheeks out, great, and then raise those eyebrows, great. Now we will be doing cranial nerve 8, so we're going to do the whisper test. So I'm going to stand behind you and then whisper some words into your ear, and then you're going to say them out loud, okay?
Okay. Apple. Banana. Blanket.
Okay, thank you. And then we would also test for air and then bone conduction, but I do not have a tuning fork, but we would do the Weber and Rennie test. So we would place the tuning fork on the top of his head and hit it, and then see which sound it lateralizes to. And then for the Rennie, we would do air versus bone conduction. So we would bang the tuning fork and then place it by his ear and then right behind its ear, about right here. Okay, now I'm grabbing my popsicle stick and testing cranial nerves 9 and 10. So I'm going to have you swallow. Good, no issues. Then I'm going to look inside your mouth. So stick out your tongue, say ah.
Ah.
And then I'm gonna elicit your gag reflex, okay?
Uh-huh.
Okay, gag reflex elicited. Now I'm going to test cranial nerve 12. I'll have him stick his tongue out and go up, down, side to side. Now we're going to do cranial nerve 11 for accessory muscles. So I'm going to have him raise his shoulders against resistance and turn his head on resistance. Okay, raise those shoulders. Great. And then turn your head. Good job. So all cranial nerves intact. So now we will be moving on. So now we are going to do the, we're going to be assessing his motor. So we are going to assess his muscles or inspect his muscles. Muscles are symmetric, and then we're going to test them. So I'll have you stand up, and then well, I guess you didn't have to stand up. Sorry, you can sit down. I'm going to test his strengths. So I'm going to have you raise those arms, and don't let me push him down, and then push him down. Oh, upper strengths are 5, and then extend your legs. And then kick up, great, and then kick down, great. So lowers are also intact with strengths of 5. Now we're going to do the proprioception. So we're going to do the finger to nose test. So I'm going to have you extend your arm, and then so here, and then touch your nose, and I'm going to move my finger. Great. Now I'm going to have you do rapid alternating movement. So I'll have your hands, yep, and then flip them slowly, back, and then forth, and then a little faster, and then faster. Good. Now I'm going to have you do your heel to shin test. So I'm going to have you take that heel and slide it down and slide it up. Now we're going to test your balance with the Romberg, so I'll have you stand up So place your feet together, arms at your side, eyes open. I'm observing for swaying. There's no obvious swaying right now. Now I'm gonna have him close his eyes. There's still no swaying, which is good. And then I'll have you sit down. Well, actually, we're gonna have you walk. Sorry. We're gonna move the camera with us. He's gonna walk. I hope you can see this. Good. Normal gait. Now heel toe walk. Oh. Okay, thanks. So now we're going to be testing sensory function. So I've got a paper towel to represent the light, and then Q-tip, soft side for dull, and then pointy part for sharp. Okay? So I'm gonna have to close your eyes, and I'm gonna be poking at you, and you tell me if it's light, dull, or sharp, okay?
Okay. Sharp.
Oops.
Dull. Light. Sharp. Sharp. Dull. Dull. Light.
Okay, those are done. And now I'm going to test his proprioception. I'm gonna have you remove one of your socks. And I'm gonna grab his big toe. I'm gonna have you close your eyes, and I'm gonna grab the most lateral part, and then I'm gonna pull up, down, or to the side, and you tell me which way I'm pulling. Okay?
Okay. Down. Down. Back.
Back to you or back to?
Towards me.
Okay.
Left side. Down.
Okay. Thank you. Now, I don't have a reflex hammer, so we'll be pretending. Okay. We're gonna do the brachial one, so I'm gonna grab his bicep one, so I'm gonna have you extend that arm, little pronation, grab his arm by the AC, and then my forefinger under his elbow, 2 inches below, and then we would strike it, and then it would go boop. And then I'm gonna have you lean forward. We're gonna do that tricep one. So I'm gonna grab his bicep and then find his elbow, and then 2 inches above, and then strike, boop. And then I'm going to grab his arm here, and we're gonna do the brachioradial one, and then find his wrist, and then 2 inches above, and strike, boop. And then we're gonna do the patellar one, or maybe just my hand. Great. Now I'm going to do the one behind his foot. Okay. Bloop. So all reflexes are 2+, which is normal. Putting this down. Now I'm going to be assessing your joints. I'm going to have you stand up. I'm going to assess and palpate. So joints look intact from the activity that we've previously done. Right? There's no tenderness to the joints. I'm going to be feeling symmetrical. Are they tender?
No.
Great, and I'm gonna feel your knees. Okay. No tenderness, no deformities, and range of motion, or not range of motion. They're appropriate body temperature. So now I'm going to have you sit down, and we're going to do your cervical range of motion. So your neck, so you're just going to be moving your neck. So tilt your head forward, back, left, and right. Any tenderness?
No.
Cervical range of motion intact. Now we're going to be doing your elbow. So I'll have you extend your elbow out and then flex forward, flex out, flex, bring it forward and then out. Elbow range of motion intact. Now I'll have you stand up for this one because it's a little easier. And then shoulder range of motion. So bring it up, down, and then bring it forward, bring it out, and then bring it in. Great, shoulder range of motion intact. Now we're going to be doing the knee range of motion. So I will have you extend it, and then good, knee range of motion intact. Now we'll be doing the hip one. So I'll have you lay down on our chairs. Okay. We would have a full bench for this. So I'm going to bring your leg up. Good. In a little bit. Good. And then out a little bit. Great. Now I'm going to have you flip over. And then I'm going to have you raise this leg, whole leg. Good. And then this one too. Good, because we did that leg. Good. Okay, now you can sit normally. Hip range of motion intact. Now we're going to be doing the spine. So I'm going to have you stand up again. Sorry. And I'm going to have you stand in front of me. Spine is in line, no kyphosis, this way. No kyphosis, lordosis, and then no masses or lesions. So I'm going to, for this purpose, you'd have a shirt off, but we're not going to do that. Lean forward, touch your toes, so the spine is still in line. Okay, great. Stand up, and then we'll be having you do the spine range of motion. So lean forward, lean back, and then face the camera, and then lean left, and then lean right. Great. Now we're going to be doing our special test. So I'm going to have you sit down with your legs up for the ballotment test. So I'm going to push down on the kneecap. If it bounces back, then there is an effusion. So we want it to be negative. Doesn't bounce back, which is good. Now we're going to do the Fallon test. So I'm going to have you stand or sit normal. And then I'm going to have you do so I'm going to have your wrists or your back of your hands together and then raise your arms. And then so we would hold this for a minute, but we're not going to do that for time. But we would ask if there's any tenderness after the 1 minute. So you're done. 1 minute is complete. Is there any tenderness?
No.
Great. Now we're going to be checking for his meniscus, and we're going to do the McMurray test. Okay. So I'm going to have you extend your leg, and then I'm going to hold his femur down and then pull up. And if there's any tenderness, then the meniscus is probably torn. Was there any tenderness?
No.
Okay. So that was negative, which is good. So this concludes the end of our assessment. Everything was within normal range unless stated otherwise. Thank you for your participation.